it is about 7:01, so we'll get started with our introductions as people are coming in. Please feel free to put your location in the chat and share a little bit about what brings you here today for this WeResearch webinar. So welcome everyone. My name is Jen Calver. I'm a registered practical nurse and the research coordinator at WeRPN. I'm here with Annette Weiser, the Chief of Nursing Practice and Research. And we're very pleased to have you join us this evening for a special presentation from our guest speaker, Natalie Weiser, who will share a novel research fellowship framework that resulted from a 2021 WeRPN funded RPN research fellowship. We will also share information and updates about WeRPN research activities. I'll turn it over to Annette.
Thank you, Jen. Good evening, everyone. Thanks for joining us for this webinar this evening. I'd like to begin by acknowledging the land on which we gather is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. For thousands of years, Indigenous peoples inhabited and cared for this land. We are grateful to have the opportunity to work on this land and by doing so, give our respect to its first inhabitants. May we dedicate ourselves to moving forward in the spirit of partnership, collaboration, and reconciliation as we learn together and contemplate the possibilities that lay ahead. So this evening, we will have an opportunity to share some background information about WeRPN's research program and the RPN Research Fellowship opportunities before we welcome our guest speaker, Natalie. We are excited to hear about their organization's lived experience and journey with an RPN Research Fellow that inspired their team to develop a novel RPN Fellowship framework. Following the presentation, you will be invited to submit your questions and share any takeaway messages you have for yourself, your peers, or your workplace. And near the end of the webinar, Jen will share some research updates with all of you and some closing remarks. So with that, Jen, I'll turn it over to you. Jen, I think you're on mute.
Everyone, I'm having a great conversation with myself. Thank you, Annette. Thank you for the introduction and getting us started. Just looking at a little bit about the background, the WeRPN research program. Upon entry to practice, RPNs are expected to use critical inquiry and research to build this evidence-informed practice, and then to research and respond to relevant clinical data. RPNs uphold this competency in their practice, yet there is a gap in the literature about RPNs and then by RPNs. So this suggests that the evidence-informed practice may not include, or there might be room to include, more information specific for the role or care provided by RPNs. So to address this gap, WeRPN provides opportunities for RPNs to build capacity in applied research related to topics about the valued role of RPNs, care excellence, health human resources, and care delivery. RPNs interested in research activities are invited to submit a proposal that outlines the research goals, a learning plan with some objectives, expected deliverables, and how the research fellowship will benefit the fellow. The RPN must provide information for the research mentor and the executive sponsor with some in-kind contributions. The RPN Research Fellowship opportunity was first launched in 2021. And in 3 years, WeRPN has funded 10 RPN research fellowships across 9 different healthcare organizations throughout Ontario. Some of the topics that the RPNs have explored are listed there on your slide, on the slide on the screen. You can see there's a lot of diverse interest that the RPNs have brought forward to be able to work on. So please join us tonight in welcoming Natalie Weiser. Natalie is a research coordinator. Sorry, I'm jumping ahead. Oh my goodness. So this evening, we are pleased to hear from the lead author of a peer-reviewed publication available in the Canadian Journal of Nursing Leadership that highlights the benefits and challenges of an RPN research fellowship and shares a novel framework that can support nurse leaders in the professional development of their nursing staff through building research capacity. And so now we're excited to welcome Natalie Weiser. So Natalie is a research coordinator 3 at Unity Health, Toronto. She has a background as a sociological researcher with experience in qualitative research and methodologies. Natalie currently works with Unity Health's interprofessional practice-based research team to support nurses and health discipline clinicians as they engage with the practice-based research questions and projects. Natalie, welcome with us today. I'd like to turn the mic over to you.
Great. Thank you so much, Jen and Annette, for that warm welcome. I appreciate it. So tonight we're going to be talking about the experience our team had at Unity Health with mentoring an RPN research fellow and sort of the framework that developed from that experience. And just to give a little bit of context to the research fellowship, we have a really lovely relationship with WeRPN. We have several initiatives that have been funded by WeRPN, and this is kind of the background to where the fellowship came in. So our foundational study was all about the barriers and facilitators to integrating RPNs into the acute care environment. And so that is the study that we brought the RPN research fellow onto. And it was, you know, as we'll talk about in this presentation, it was really a great fit to come into that particular study. And then moving forward, one of the topics or themes that came out of that initial study about integrating RPNs into acute care was this idea of role clarity and what it means to have, you know, a specific RPN role. And so related to that, our current project is all about creating a shift assignment toolkit. So this is for charge nurses who are assigning patients to either RPNs or RNs, and kind of how can that role clarity piece be addressed through this novel shift assignment toolkit. So that's what we're currently working on. And then as we think ahead to the new year, we're going to be looking at the RPN role in a rehabilitation setting. So there's lots on the go at our organization and with our team, and we're really pleased to be continuing this this relationship that we've built, researching the RPN experience. Okay, Jen, next slide. Great. So just thinking about why we need an RPN research fellowship, or sort of what is the value of this initiative. We know that engaging in research and evidence-based practice are very important to both the professional development of RPNs and also to providing high quality patient care, right? So it's really important both at the RPN level, but also it transitions into providing, as we say, high quality patient care. And so it was clear that there's a gap when it comes to RPNs and research, in particular because we know that the practical nursing programs in Ontario do not include research in the 2-year diploma curriculum. So here we're thinking about, you know, both the theoretical components of research and the methodological components of research. So there's definitely a need, there's a gap that needed to be filled. And this is really where the WeRPN Research Fellowship came in. So the purpose of the WeRPN Fellowship was to create or to increase RPN's research knowledge. So really knowing about how to do research, having the capacity to do research, and then most importantly, I think, at least from our experience, nurturing confidence in leading small scale research studies. And I think that confidence piece really shouldn't be overlooked, because I think actually one of the pieces of feedback that we got from our fellow was that they were sort of nervous or, you know, anxious about engaging in research because this was such a new field for them. They knew sort of a little bit, but it was really something that felt kind of big and overwhelming. And so I think that confidence piece is really important. And I'm happy to say that I think as the program went on, our fellow really did gain that confidence to like read research, right? So to engage with literature, to know how to do research herself, and to mentor others who are maybe thinking about doing research or kind of need that almost like a buddy system, right? Where you have somebody who's gone through it and you can kind of provide that support to say that, I was nervous about doing research, but I think, having had the mentorship, there's a new confidence to move forward. So I think that piece, it seems like a small thing, but I think it was actually really important in our experience. Next slide. Okay, so the objectives and goals of the fellowship. I think what's so great here is that the two organizations, so Unity Health Toronto and WeRPN, both have goals and missions around research that were really aligned. So from the WeRPN side, part of the goal was to build RPN competence in research engagement, advance the RPN's expertise, and really have them drive evidence toward best clinical practice, right? So when we talk about evidence and best clinical practice, we're really talking about developing research that comes from the bedside, from the clinical world, and moving that research, not just from a journal article, but putting it into practice and really having it push best practice forward. So that's from the WeRPN side. And from the Unity side, at the hospital, our organization is very much committed to fostering a culture of research and discovery among clinicians. So really having research embedded in kind of the day-to-day, always thinking about research, having it kind of blended in with the clinical world. So not having them siloed, right? But really having them merge together. And so I think both those both the organizations, those objectives and goals were really along the same path. And I think that is something that helped propel the fellowship forward very well. And then specifically for the research fellowship experience, the goals were as follows from our end. To number one, introduce the RPN fellow to research activities, right? So to really get them doing research. Secondly, to bolster the RPN's capacity to model evidence-based practice to peers, thereby contributing to this culture of research, right? So especially on units where RPNs were newly integrated back into our acute care setting, having an RPN on your unit who's doing a research fellowship is so valuable because you're starting to hear about research and you're understanding kind of how the research can be embedded in the day-to-day clinical work. So it really contributes to the culture to have an RPN who's, coming back from their fellowship days and talking about what they've done, right? And then thirdly, developing a framework for the structured approach to the fellowship. So once our team had, finished the fellowship and we reflected on, what were the components or what were the aspects of the fellowship that made this successful, that's how we developed a framework so that other organizations could then take a look at this and say, okay, these are the pieces that, should be in place for a successful experience. So let's go to the next slide. Okay, so fellowship implementation. So here's where, we're getting started with what is this fellowship going to look like? How are we going to find someone? So this all really got started by putting out a call at Unity Health Toronto and seeing which RPNs were interested, right? So we gave folks an opportunity to self-select and to reach out to our team. And we also engaged with clinical leader managers on units with RPNs to ask if there were any RPNs who were interested in, again, doing this research fellowship. So we had a great fellow who was an RPN in an outpatient unit at the hospital. A little bit by way of background. So she worked as an RPN in Canada for about 10 years, had some experience with quality improvement projects, but not research projects per se, and had some experience with mentoring students, mentoring and teaching students. And so we brought her into this study. And so the research article that you see here, this was our, what we call our foundational study. So this was the first grant or study that we did with WeRPN. And this was, as I said, all about how RPNs were integrated into the acute care hospital. Our hospital was somewhat unique, I think, in that at one point we did have practical nursing. It then became an RN only hospital for the most part, and then RPNs were reintroduced around 2020. And so this was a really great living laboratory, if you will, for understanding what were the barriers, what were the facilitators, and really trying to understand from the RPN experience or perspective, um, again, what was going well, what could be improved. And so this is the study that we brought our fellow into. And again, I'll talk about this as we move forward, but just by nature of even the topic of RPNs being sort of the main participants or the subject of the study, this was a really great fit to have an RPN on our, not only do the fellowship, but also be a really integrated member of the research team. Next slide. Okay, so I'm going to get into a little bit about the logistics of how we implemented the fellowship. So I'm going to talk about sort of two components. There's what I call the research education, and then the application of that research training. So it's kind of the theory and then the application or the doing of what we taught. So our program was delivered 2 times a week, 8 hours a day. So 2 full days. I think it's worth noting these were paid days with paid protected time. So there wasn't like a juggling act of having to do clinical days and the research days. And I think that was also a foundational aspect of the success of this program, is that it was paid time where you could focus solely on research. So 2 days a week. And then this began with really a research education, sort of operating from the understanding that this was a completely novice researcher. So we didn't expect any kind of coming in with experience or knowledge, and we really started from the ground up. So we had things like mentoring sessions with our team, IPBR, we're interprofessional practice-based research. And as Jen had noted in the introduction, our team, we are set up to really be supportive of nurses who are interested in building their research capacity. So this was already set up in-house. This is what we do. So we were really well positioned to support an RPN in developing research skills. So really lots of mentoring sessions. We have a research skills building workshop where we give training on how do you develop a research question, right? Like, so really from the get-go, how do you come up with a research idea? Where does that research idea come from? What methods are you going to use to carry out your research? So really just starting from the ground up. And then part of what our fellow did also, everybody who does research at the hospital and in most organizations have to do research ethics training. So there were some tutorials about research ethics and how you engage with participants in an ethical way. There's a foundational tutorial called Good Clinical Practice, the GCP. So everything that researchers do, our fellow had to, do that level of training. So again, we had the one-on-one mentoring, the research skills workshop, and then we did sort of move into what I call the application of research training. And we focused, I'm just going to kind of put an asterisk here, on a more qualitative project. So when we talk about qualitative research, we're talking about research that's looking at the how or the why, right? So we're interested in understanding participant experience, participant perceptions. So we're not looking at a quantitative study where we were counting and like asking how many or how often. We were interested in RPN experience. So we tackled that from a qualitative research perspective. And because of that, we had our fellow do qualitative research methods. So for example, designing an interview guide. So one of the ways that we got at, the main way I should say, that we got at understanding how RPNs were faring in the acute care setting was to do interviews with them. So we did interviews that lasted 30 to 60 minutes, asking them all sorts of questions about their onboarding, the level of support they have on their unit, what could be improved, do people understand the RPN role? So these were all questions that we asked in a semi-structured interview. Semi-structured meaning we usually asked all the same questions, but sometimes we would veer off course to probe interesting caveats or experiences that people had. And so with our fellow, they participated in designing the questions. So questions that we were going to ask of RPNs. They conducted mock interviews where sometimes I would be the participant and they would be the interviewer, and then we would switch. And then once we did collect all the data, our fellow helped in the thematic analysis. So if you can imagine, we recorded all our interviews, we had them transcribed, and now we have pages and pages of data with RPNs telling us about their experience. And we have to somehow analyze this and put together a story or figure out kind of what is the data telling us. So our fellow was very much instrumental in helping us with that analysis. And I'll speak about that a little more as we move on. Next slide, please. Okay, so the RPN as a subject matter expert. I think this is really such a lovely part of the experience that our fellow had. The RPN was very much a key member of the study team. And I think what was so important was that her clinical knowledge really complemented our research expertise. So our to just to be transparent, like we are the research team. We support with all the research methodology. We're not clinicians, so we don't really have that oversight or purview into what happens in the hospital, right, at the bedside with patients and that sort of clinical world. But that's where the clinician's experience, it really comes in, and we sort of blend those together. So to give you some examples, our RPN fellow helped with making decisions around participant recruitment, right? So we had to understand even something as mechanical as her telling us that nurses don't usually check their Unity Health email. So you might have to forward this to their personal email, or else they might not read this, right? So we would send out recruitment emails looking for participants, and sometimes we would get back a few emails, sometimes we wouldn't. And so I would not know as a researcher that maybe nurses are not looking at their work email as often as they would be looking at their personal email, for example. And so something as simple as that, and just knowing that detail around what is the lived experience of an RPN, and are they going to check their email, or should we be putting posters up in their clinical area? So really helping us with the logistics around the recruitment. And then the data analysis, as I mentioned, this was a qualitative study where we were looking through transcripts and trying to figure out what are some of the key themes, what are the patterns, and what we were being told about the RPN experience in acute care. And so when RPNs were explaining, their experiences with onboarding and team dynamics and, different scenarios they had been in, it was really helpful to have the RPN on board and reading through those transcripts with us, because there are things and nuances that I certainly would have missed, or I might not have understood in the same way that she did, because that's her day to day, that's her lived experience. So whereas I was able to say, here's how we code, like let's look through this line by line, and I'm going to explain to you how we extract themes and patterns. She was able to sort of explain to me, like, what does this mean, right? Like, so if somebody explained something about their experience, I knew sort of what to do with it from a research side or lens, but I really needed to understand the nuances and the richness of what this story means. So that was a really great partnership. And then the leadership development, I think, was a really unique experience for our fellow, and something that I don't think she would have had access to if not for this program. And so some examples of that are our fellow joined all the interdisciplinary research team meetings with the principal investigator. So the principal investigator meaning the individual who's sort of the lead of the study. We were a study team, and it was interdisciplinary. So lots of nursing folks, but also interprofessional, other health discipline clinicians were on board. Our PI, the principal investigator or the study lead, is a member of the hospital executive leadership. And our RPN fellow had meetings one-on-one with the PI, where they got to hear about the history of research at the hospital and just sort of what the research culture is, and just having that opportunity, I think, to network and engage and have FaceTime with the hospital leader is really unique, and I think a great experience for the fellow. And then also having a presentation opportunity, much like what we're doing tonight. Our research fellow had the experience of sharing her experience at doing the fellowship at a WeRPN webinar. So again, really nice. I think such a great opportunity to practice that knowledge translation and just highlighting how her confidence in research was developed over the course of our time together. Okay, next slide. Just one back, perfect. Yep, that one with the figure. Okay, so this is a cute little figure that came along with our research fellowship. It was really nice. The journal helped us with this cute little cartoon figure of, I guess that's supposed to be an RPN. But this is our 6 component framework for what we feel makes the fellowship possible and what we think are the key elements of a successful RPN research fellowship. And so I'll just go through these, not in too much detail, but really just at a high level to think about for organizations who might be thinking about implementing a similar initiative. This is what we think would be sort of the keys or the foundations for that. So number 1 is the program infrastructure. Here we have things like research support staff. So my team, the IPBR team who supports nurses in building their research capacity, that team was already established at the hospital. The funding, of course, the funding for the program is key. And as I mentioned, having that paid protected time, which is often so hard to come by. And I think one of the main barriers for clinicians who would like to do research is having the time, right? So having the funding was huge. And then all the sort of aspects of the hosting organization. So coming to a hospital like Unity Health, we have a research ethics board. We have an office who looks over grants and contracts and all the sort of logistics of what you need to get a study up and running. We have in-house at the hospital. So I think that was really important, is that infrastructure. The second component is the research education. So again, having those research workshops, the online research ethics modules, having the ability to shadow our team and shadow researchers and really come on to an existing research team really contributed to that lived experience of having a research education. So we did spend quite a lot of time talking about the theory behind research and what is qualitative research and what is quantitative and how do you, submit to the research ethics board. So all the kind of mechanics, I think, of the education were really important. And then moving from that education, the third component is the application of training. So having hands-on experience with doing the research. We engaged with our librarians to learn how to do a literature review. And again, being able to walk together through all these stages of collecting the data, analyzing the data, as we move into manuscript writing. So really being able to see kind of all the phases of the research applied. The fourth is the integration of evidence-based research. So being able to have an opportunity to share research findings across the unit, across different clinical spaces, and really applying the clinical expertise in your role and sort of integrating it into research, right? So this is that theme I've been addressing, is that complement between having the research expertise, but building in the clinical expertise and sort of working together so that those aren't siloed. The fifth component is the leadership development. So one, I think, really nice trickle-down effect of a fellowship like this is that the RPN who went through the program can then mentor other RPNs on the unit or other colleagues in research, and even participate in things like research advisory committees, right? So just really participating in that culture of research. And then we think a sixth component is understanding or evaluating the fellowship. So understanding the satisfaction of the RPN fellow, and something we didn't do but we think is important to do is a return on investment assessment. So really understanding how putting in the effort with a fellowship such as this, like what is the output down the road as far as research output, and what is the return on that investment in the RPN fellow. So we think these are the not the be all end all, but the 6 key components of what would be needed or that would best serve a fellowship such as this. And next slide. And then finally, just some having, reflected on the experience, both mentoring our fellow and having, wrapped up this experience. Some of the benefits we think of the fellowship are as follows. So having the fellowship tied to an existing research study really allowed our RPN to quickly join the study team. So this study was already up and running. We didn't have to, work through a protocol and like figure out what is this study going to be or what are we going to do with them. The study was ready to go, so they were able to really seamlessly hop on board, and I think that made things quite efficient. A second benefit was that the IPBR team were already trained to support the RPN to build their research capacity. So my team, as I mentioned, we have workshops, educational materials. We consult with nurses every day about how to do research. So we were, again, really well positioned to support the fellow in building their confidence in research, right? This is what we do every day with our clinicians. So it just came together really well in that sense. And then finally, a benefit of this fellowship was we were able to support the strategic objectives of WeRPN's research priorities. So again, advancing expertise, advocacy, and influence in driving evidence on optimizing that RPN role, right? And so again, our main project was about figuring out what is how we can optimize the RPN role in an acute care setting. And so again, I think having the fellow on board really helped us to do the best study we could do on a topic such as that, because we had both kind of the research world and the clinical world coming together. And I think it made the study much stronger than if we didn't have this fellowship layered on top of our study. Okay, and with that, I think that's my last slide. Thank you so much.
Thank you so much, Natalie. It's incredible the work that's being done. Before I joined WeRPN in the role of a research coordinator, I had an opportunity to do an RPN fellowship, and it's wonderful to see what your organization is doing. And I could see taking that framework and even using it to help facilitate some of those discussions, because you described it really well in your presentation. Terms like qualitative research, semi-structured interviews. At the first, you're like, what is that? Can we talk about wound care? So you did a great job providing that. We just want to open it up now to the group here. If anybody has any questions for Natalie or for us at WeRPN before we go into some of our research updates, please enter it into the Q&A at the bottom of your, there should be a Q&A button at the bottom of your bar there on your Zoom screen, or you can enter it into the chat. Reorganize here. I think we have a mixture of RPNs that have been engaged with Introduction to Research course. So they're starting to look at what research is. We have some people here that have been mentors or are interested in becoming mentors of RPNs in their organization. And we have some executive sponsors. So it's really great to see everybody here. I do have a question coming through here, Natalie. Can you tell us how important was the engagement of partners and collaborators in the development of the toolkit?
Oh, so the toolkit? So that's a separate study. I can speak to that a little bit. We'll be talking about the toolkit project a bit more at the WeRPN conference in November. So spoiler alert for what's going to be coming down the road. But regarding the toolkit, yeah, stakeholders were very important because, again, as researchers, we're not so familiar with what goes into assigning patients to nurses, right? Like this is very much the world, the clinical world. And so in developing a shift assignment toolkit, we didn't even really know where to get started with what component. So we had to do lots of interviewing with charge nurses, clinical leader managers, to understand, what does the shift assignment process look like now? What are the gaps? What could be improved? And then we had to kind of go back to the drawing board as a research team and say, okay, based on what we're hearing, we think these are important components of a toolkit, right? So I think, if I'm understanding the question correctly, is like, how important was engaging partners and stakeholders for that particular study? It was key because, again, we were really starting from a place of not knowing what it is that charge nurses do and what this process looks like, and how like how streamlined is it, or how consistent is it across units, across sites, because Unity Health is a multi-site organization. So, is it the same between the acute care site, between the 2 acute care sites? Is it unit specific? So, like, what exactly is going on in that process, and how can we as the research team come in and figure out a way to make things better, or to pilot some resources that we think might help the process. So definitely stakeholder engagement is always key. And again, with our team, because we are research based and we're not clinicians, we really value that expertise of what's going on in the day-to-day world of the hospital.
Thank you. We have another question here, and please go ahead and put your questions into the chat in the Q&A. We have a question here asking, what would be your recommendations for how RPNs can get started or start to look at introducing a fellowship to the organization?
Yeah, as far as introducing it to the organization, I might leave that to you guys to answer, but I think I can speak to how we came, like, once we knew that we were going to be engaged with a fellowship. I think one of the key parts was figuring out who was going to be our research fellow, and making sure that it was somebody who was really interested, right? So we don't want to push people down a path that maybe they're not ready to go down. And I think our research fellow was very much keen on developing those skills. And also, I don't know if I touched on this in the presentation, but if I didn't, it's important to note that their manager was very, very supportive, right? And so I think having a supportive leader and manager who sees the value in their RPN having that knowledge and research capacity, or research expertise, I should say, really helps bolster the experience, because we knew that and I should say too, their manager was on our main study. So that was also a nice fit, is that they were already engaged in research, but having a manager or a leader who sees the value in you doing a fellowship like this, I think is really key. So showing that that is something you really want to do, it's part of your professional development, being able to understand how the experience and the knowledge that you gain will be valuable for your unit is I think really, really important. So I know that doesn't answer the question about how does the fellowship come to the organization, but I think Jen or Annette, you might be better positioned to speak to that.
I think that's helpful too, then, because there are some background work happening in organizations that, as you said, an RPN can really get involved and start strengthening. And so it can be a collaborative introduction into applying for the fellowship. We've had some other teams where, the RPN's been in practice and they're like, I know there's got to be up-to-date evidence in this particular clinical area. And I feel it, but I don't really know what to do with it. And so WeRPN does have a resource based on some of that feedback that can help facilitate some of those conversations, and it breaks down the application on how to bring it forward to that supportive manager. And I know sometimes that can be a little bit nerve-wracking too, when your time is spent in a particular unit or a home area or out in the community to make that first step. But generally, from the feedback we get, is that it's usually very well received. And so there are supports available for that. I don't know, Annette, did you have anything else to add to that? I think that's a great question.
No, I think that's a really good start. We always have Jen available for you if you have any specific questions you'd like to know about if you have an idea and how you may present that. We're always open to meeting with you to talk to you about how you could get started on a fellowship. I think another part of that question was how often are they offered, and they are offered every year. Jen, you're going to be talking about that a little later when the next application is open.
We have a few highlights for the research, and then also the symposium we'll start to make more announcements around that anticipated call. Yeah. Great. Thank you, Annette. We have another question here. Who should the RPN approach in their organization? And I think that is very much dependent on the organization itself. Now, in the RPN's organization, having that support of their executive sponsor, so somebody who's going to stay with them and see their project through and be their touch point, somebody who can look at what the 30% in-kind contribution looks like, whether it's office space, use of the printer, different things like that. So that might be your first connection inside of an organization. And then you can also connect with researchers across the province who are interested or who are doing something that you think would be very valuable, and send them an email. I love to do that because people are working very hard and they often like to share what they're doing, and they value your feedback. What we're hearing is that people want to hear from RPNs. They want to hear those ideas. So between the two, I guess to be a little bit more clear too, so an executive sponsor might be the nurse manager. It could be maybe a director, or it could be the administrator of a building. And my email is always available there, and we can always support you with those first steps to navigate what's unique in your organization. I don't know, Natalie, Annette, do you have anything to add to that? Okay. I'm just being mindful of the time here, and I know how busy everybody is. If you do have any more questions, please shoot them to research@werpn.com. And if they are for Natalie about the framework, and then we can go ahead and forward those and connect you with Natalie. So I apologize. I have a bit of a cold. So if I'm coming across raspy, I'm just at the tail end here. So please bear with me. So we'll look at some of the research updates. So at our WeResearch webinars here, we like to keep you in the loop of what's been happening in the research program and the activities. So first off, we would love to introduce you to the members of this year's Research Advisory Council. The WeRPN Research Advisory Council provides input, contributes to expertise and guidance on the research activities and the programs at WeRPN. So we're very pleased to welcome the 2024-2025 council members, and we're looking forward to working closely with them on research-related activities and planning. If you are interested to join the Research Advisory Council, the calls for statement of interest will open up in January 2025. The positions that will be upcoming in the new year is one RPN representative. We're looking for one public representative. So this is a family of somebody receiving care by an RPN, a caregiver, or somebody who's received care themselves by an RPN. And then we're looking for one academic college representative this year. The REC members do serve a 2-year term. Sorry, I'm so sorry. And then the members provide guidance and advice on all the research activities. The information is also available on the website. Just going to take a little sip of water here so you don't lose my voice. So here we see each year, WeRPN celebrates nurses through several categories of awards, including 2 research awards. One of these awards of excellence in research is for RPNs, and there's one award for excellence in research for organizations, otherwise known as a Nancy Snowbellum Award of Excellence in Research. The award winners are going to be announced this year at the upcoming AGM on October 24th. You can register. Please visit our website to register. It's WeRPN.com/events. We are also pleased to share that WeRPN is hosting their 3rd annual research symposium on November 29th at Humber College. The Research Symposium is a free, interactive, in-person event that will explore emerging research about the value of the RPN role. It will look at some evidence-informed practice and workplace planning and development, research outcomes, implications, and expected significance for RPNs, client care, care delivery, and the healthcare workforce will be shared across various sectors and interests. Some of the topics include optimizing the role of RPNs in the operating room, geriatric rehabilitation, resilience in home and community care, and workplace retention and long-term care. There will be also interactive sessions, and these interactive sessions will provide opportunity to network and exchange knowledge about the usefulness, applicability, and impact of these emerging findings. We will also hear from past RPN research fellows about their fellowship experience and some of the lessons learned to help RPNs and their team to prepare a research fellowship proposal. So from your questions today, if we didn't answer them, come and speak to people who have done it, and some of their mentors will be there and some of their executive sponsors will be there. And don't be shy to go up to them. As that people do enjoy often sharing their experiences. So if you are interested in joining us on November 29th, you can go to WeRPN.com at events to register. It is a free event. The food's always lovely. A little snapshot at what's been happening between July and October, so our Q1. We have ongoing Begin research, so our bridging education, grant, and nursing research that's led by Dr. Conley at Western University. Within that research, there's 11 studies ongoing. 2 studies are in data collection, 2 studies are in analysis, and 1 study is awaiting ethics approval. We had just ended 4 WeRPN funded research grants for the 2023-2024 period. We were very excited to see those 3 reports. And then we do have one that we're just waiting for on January 30th. So we'll have some of those findings to share with you. So keep an eye out on our WeResearch newsletters that will provide some of those highlights. The teams will also be presenting their findings at the WeRPN Research Symposium. We have 3 research fellows, again, that are just ending from the 2023-2024 period, and we've received all of their reports, and it's going to be very exciting, again, to hear them speak at our research symposium. Looking ahead at the 2024-2025, WeRPN was able to support 7 teams with research grants this year. So that is fantastic. All agreements have been signed. They're going to start reporting updates on their project. The interim reports are due around January 10th. So we'll keep you up to date on what's happening with some of these projects as we move forward. We are also able to fund 3 RPN research fellowships this year. And the same thing, their agreements have been signed, and they're going to keep us up to date along the way as well. When we're looking at some of the research outputs that have come from the research that's been done, like Natalie presented this evening on her 2 studies, and we're going to hear more at the symposium. There are 4 new scholarly publications just between July and October that come to our attention. We have released 2 research newsletters that have updates about what RPNs are doing with research. We highlight events. We talk about the Introduction to Research course. If there's opportunities, we answer questions through these mediums. Upcoming, we're going to keep an eye out. We were told that there are 5 more manuscripts in draft that people are looking at submitting here. We're going to have another WeResearch bi-monthly newsletter coming out about October, November, so it'll be there soon. And then we do our monthly updates in the Pulse newsletter. For some of the education around research, WeRPN offers an Introduction to Research RPN course. So we just ended our summer 2024 research course, and everybody got their certificates. And then we have a course right now in progress in week 4. And then we also do these quarterly WeResearch webinars to help keep you up to date. And we offer the opportunity for some of our researchers to come forward. So if you are working on a research project and you think that this is a great platform to be able to share some of your work, please email us. We'd love to speak with you. And then upcoming, again, we'll mention our annual research symposium. As you can tell, we're very excited about this event because it's a chance to bring everybody together and really be in one room and network and connect and share all this great work that's being done. And then we're looking ahead to the registration opening for the Introduction to Research course in winter of 2025. So if you are an RPN or if you are supporting an RPN in research and think that they might be interested in that course, we'd love to hear from them. So on this slide, you will find different ways to keep up to date on WeRPN research activities, research outcomes, as well as upcoming events and opportunities. So this includes the anticipated call for proposals for academic grants and for the RPN research fellowships for the year 2025-2026. We'll share more details around the date at the symposium and then thereafter. So keep an eye out on our social media and the newsletters that are coming out. And at this point, I don't see any more questions in the chat. So I'll just give a huge thank you to everybody for joining us this evening to learn about WeRPNs research fellowships and to hear from our lovely guest speaker, Natalie Weiser, on how their institution discovered this unique framework that can empower RPNs to develop applied research skills, leadership, and training. We thank you and your team for this wonderful work that you're doing. WeRPNs, there's some really great comments coming up here in the chat for you, Natalie. WeRPN's growing research infrastructure is supporting increased RPN representation in research. And so the aim is to redefine RPN roles, impact, and credibility through evidence. So this means that we're going to be able to say, hey, look, did you know? And we'll be able to show them. So by establishing partnerships with academic researchers and bringing organizations together with us RPNs, we're growing a supportive research ecosystem for RPN inclusive research initiatives. As Natalie said, the voice of RPNs is so very valued. The competency, that scope and knowledge that they have is so valuable. RPN research fellowships can be helpful to address population needs, trends, and emphasize RPN competencies while building a culture of research to facilitate interest and create an inquisitive knowledge culture to support evidence-informed practice, and then have that competence in leading or contributing to small-scale research studies. We hope that everyone enjoys the rest of your evening, and we really look forward to seeing you at our next event. Thank you, everyone.